are the signature program of Jonas Philanthropies. We hope everyone is doing well today and staying healthy in this season. We would like to thank our partners at Columbia University School of Nursing for providing our continuing nursing education credits today. And Columbia University School of Nursing is actually accredited as a provider of nursing, continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. That was a mouthful. So the link to the evaluation for CNE credits will be posted in our chat, and it will be sent to all of our attendees today after the presentation. So today's webinar is entitled, What Every Nurse Needs to Know About Health Policy. And our speaker today is our very own Dr. Stephen Ferrara, Executive Director of Jonas Nursing and Veterans Healthcare, also the Associate Dean of Clinical Affairs and Associate Professor of Columbia University School of Nursing. Dr. Ferrara has also served as the Executive Director of the Nurse Practitioner Association of the New York State. So he has a range of knowledge and expertise in the area of health policy and advocacy. As a reminder, please remember to use the Q&A function for all of your questions you can submit today for Dr. Ferrara to respond. And now we ask that you please turn your attention to our Dr. Stephen Ferrara for our health policy webinar today.
Thank you so much, Dr. Hicks. Hi, everyone. It's my pleasure to be here today talking about one of my favorite topics, which is health policy. It is one that I truly believe that everyone should be involved with, and especially nurses. And we're gonna jump in and we're gonna have an interactive session with you today. So with that, we'll get started. All right, so we're gonna get started by taking a poll. And our first poll question is, have you ever scheduled an appointment with your legislator? And if yes, was this at the city, state, or federal level? And you can select multiple choices here. So take your time and answer these first two questions, and then we'll go from there. Just give it 1 minute so everybody can get situated and take this poll question. All right, why don't we close the poll? Okay, so looking at the results, 72% of our participants today have not scheduled an appointment and met with your legislator, and 28% have. It looks like the majority of folks met with their state legislators, and 66% weren't sure as to where those legislators fell in the grand scheme of things. So I'm really excited that we will hope to shine some light on that mystery of what we call legislation and politics. And we're going to start out with state policy basics. And we start with how a bill becomes a law, right? And in order for any law to be passed, it has to be introduced. There has to be a written document that talks about what this law would do. And that introduction requires a bill sponsor. And the sponsor is going to be one of the legislators, and they sponsor the legislation. And depending on where the bill falls in on the grand scale of things, if it's a health-related issue, oftentimes it would be directed to the health committee. And it goes into the health committee, and the health committee will typically debate the bill. And if it passes out of committee, then it could be scheduled for a floor vote on the we call it on the floor, where the entire body takes up that vote and that issue. And if it successfully passes, it goes to the governor, where the governor can either veto it, which means the law does not pass, or the governor can sign this legislation into law. Once it's signed into law, it's the law of the land. Sometimes there's provisions that say it takes effect in 90 days. Sometimes it'll say it'll take effect the next calendar year. There's always a date. It always gives very distinct information as to when that law takes place. Oftentimes, a law will not take place the day it's signed, because there's a lot of regulations that need to be written that go alongside the law. And I'll get into that in a little bit. If the governor does veto it, a veto can be overturned by a 2/3 majority of the legislature. And I will say that that is very uncommon. That does not typically happen. It is very difficult to get 2/3 of a majority of anyone these days to overturn a veto. So this is the basic information of how a bill becomes a law. Some of you may have seen the Schoolhouse Rocks, a little cartoon back in the day of how a bill becomes a law. And that is truly a very simplified process of how we get an idea turned into a bill, going through the proper channels, and then being signed by either the governor or the president. All right, so state legislation will apply to people living in that state. And to think about it, we do have 50 states, with Washington, D.C. also counting as a legislative body for the District of Columbia in and of itself. And different states have different laws. And it is certainly incumbent upon people living in that state to know what the law is in that state. And I'm sure you're familiar with issues that a law applies in one state, but is not necessarily the same law in the other state. That is state law. That's different than federal law. And again, we're gonna tease some of that out as we go on. But state laws is what we're focused on first. And each state has its own legislative session and calendar. And it's very rare that two states have the exact same calendars. So I'm going to give you an example. I'm in New York. Our legislative calendar in New York is January to June of every year. Our legislative session is the first 6 months of the year, which is the only time that bills can be introduced and debated and passed or not in the state of New York. So after June 30th of this year, there will be no bills that could progress in the legislative body system, because the session will end. Now, there are always asterisks to that. There could be special sessions of the legislature, and this is uncommon. But there can always be a special session called for the legislator to come back into session, but that usually is only for emergency situations. It's not very common to have the legislature reconvene after the session has ended. There are some states that in a 2-year legislative cycle, they only are in session one of those 2 years. So it's really important for you to understand when your legislator is in session and when they're not. And even in New York, when they are in session, they're only at the Capitol 3 of the 5 days a week. So those other days, they travel back to their home districts so they can do the work in the district. but the work that needs to be done as far as committees go, as far as everything else goes, that is only when they're in session. So I would tell you to visit your state's website to search what legislation has been introduced. Every state has I wasn't going to list all 50 states and DC because nobody could ever read that. But every state has its own website where you can search for bills that have been introduced, bills that have passed, and bills that have not successfully passed. You can find all that information on their website. And a good one-stop shop is going to be the National Conference of State Legislators, ncsl.org. And they have links to all the states, so you could sort of, not have to use your search engine to find everything. You could go there and find all the information that you need. All right. The next thing we're going to talk about, because we're talking about health policy for nurses, is our Nurse Practice Act. And our Nurse Practice Act is what defines the profession of nursing in the state. So I am going to read these things of what every state's Nurse Practice Act is, and then we're going to take a poll after this part. So every state's Nurse Practice Act has to have these following things: the authority, power, and composition of a board of nursing, the education program standards, so what schools need to do in that state in order to offer a nursing curriculum and program, the standards and scope of nursing practice, the types of titles and licenses that can be used in that state, the requirements for licensure, and grounds for disciplinary action, other violations, and possible remedies. And the important thing here is that whenever we're talking about Nurse Practice Acts, it's at the state level. The President of the United States does not sign legislation for the states. The governors of those states sign it. And when we talk about Nurse Practice Acts, those are solely up to the state to enact and enforce. So it's time for a poll question. And this is poll question number 4. And this is, have you ever read your state's Nurse Practice Act? And remember, we are bound by this Nurse Practice Act at all levels of nursing. If you're a licensed nurse, so whether you're an LPN, an RN, a nurse practitioner, a registered nurse anesthetist, we all have to have a Nurse Practice Act, and we all have to follow the Nurse Practice Act because that's what we're held to. So we'll wait 30 seconds and see if what responses are regarding if you yourself have ever read your state's Nurse Practice Act. All right, why don't we end the poll there and see what, all right, so the majority of people have read the Nurse Practice Act. 60% have read the Nurse Practice Act, where 40% have not. And I do not blame those who have not read their Nurse Practice Act. It is often not fun reading. It's very gray in lots of areas. And it's very hard to find an answer to a question you may have by simply reading the Nurse Practice Act. I'll give you some examples of some of the challenges with different states and different Nurse Practice Acts. So I'm going to use the state of New York because it is the one I know the best. In New York State, certified registered nurse anesthetists, CRNAs, do not have title and scope in the state of New York. That's not to say that CRNAs don't exist in New York. In fact, they certainly do, but they cannot apply for licensure in the state of New York to be called legally a CRNA. And that's because the nurse anesthetists have not been successful in getting the Nurse Practice Act amended to include this advanced practice nurse specialty. Whenever this issue comes up, the opposition, and the opposition tends to be the anesthesiologists, they fight vigorously with information you can call misinformation, and money. And they have been able to successfully thwart nurse anesthetists from getting their standards, their title and license in the state of New York. So when nurse anesthetists in the state of New York are practicing, they're essentially practicing under their RN license. Of course, they have education as a CRNA, and they've passed their required exams as a CRNA, but the facility they're working for is granting them the privilege of working as a CRNA. They can't work outside that institution as a CRNA. So it's very, very limiting. And that's one example. The good news is that RN practice is pretty standardized from state to state. That doesn't mean you can pick up and go to another state and just start practicing as an RN. You need to be licensed in that state. But the scope of practice is generally the same. One of the areas of advanced practice nurses that differs widely from state to state are nurse practitioners. And in some states, there are actually 24 states right now that allow nurse practitioners to have full practice authority, which means that nurses can practice at the top of their licenses. They don't need any written agreement or requirement to have with another profession. The other states have to have some version of either an agreement, a contract, or a relationship in order to practice. And that varies from state to state, unfortunately. And this makes it very hard for individuals who want to eventually move to another state. You can't just assume that a nurse practitioner in one state can have the same authority in another state. So you definitely want to do some homework and check out the Board of Nursing website and the Nurse Practice Act to see what it is you can and you can't do in those states. And I am going to take everybody's questions at the end. So if you have any questions about this, I urge you to use the Q&A box and type your question in there, and we'll get to that at the end. So I'm happy to take any questions for anything I'm able to answer. All right. So that is state policy in a nutshell. But I've only really talked about the profession of nursing for all intents and purposes. But there are many, many other issues that are health policy related. Think about immunizations for school. Every state has their own standards. Many follow the CDC recommendations, but not everyone does. So there have been in recent years an effort to get the meningitis B vaccine passed to be part of a mandatory vaccination for college age students. It's not the law everywhere. So you definitely want to look at that. And of course, using an issue like vaccinations, it's very controversial, and we've certainly seen this with COVID. And what I always like to mention to people is when you're speaking about health policy, or if you're speaking to a legislator, try very hard to not talk about politics, and try and focus on the policy per se. Because we know once you start talking politics, it shuts people down, and there's a very difficult way to get people back. And I say this regardless of what political party you affiliate yourself with. You want to go in with evidence. We are an evidence-based practice. So you want to have your data, and you don't want to necessarily get into, what Senator so-and-so said. You really want to talk about public health, because that is what we do as nurses and as advanced practice nurses. So nurse practice acts are only one part of it. There are many, many other parts of health policy, climate change and climate health. There's lots of states introducing bills that would limit, the use of fossil fuels for certain buildings and things like that. So these are all going on right now. It's really important to be up on that. All right. So now I'm going to shift from state policy to federal policy, and there is a difference, and this is essentially our three branches of U.S. government. There is the legislative branch, which is Congress. We have the Senate, and we have the House of Representatives. Then we have the executive branch, which consists of the president, vice president, and their cabinet. And we have the judicial branch, which is the body that interprets laws, and it's the Supreme Court and the other federal courts that make up the federal court system. So federal laws generally apply to people living in the United States and its territories. So this is going to be broad type of laws that apply to everyone. And the body that is in charge of writing laws is Congress. And we have a bicameral Congress. And in the United States, the bodies are known as the House of Representatives and the Senate. These are two separate bodies, but I will get into what their focuses are, because while they are different, they have to pass the same legislation in order for it to end up on the president's desk that they could sign or veto at that point. So let's focus on the House of Representatives first. So every House of Representative member, they run in 2-year terms. And you may be aware that this is an election year. So every one of those seats, 435 district seats, are up for election this year. Now, that's not to say that every district has a competitive race, but technically every district needs to be elected in 2022. So in November, we will all be going to the polls, and we will be voting for our members of the House of Representatives. And every individual has one House of Representative member and 2 senators. So you have one House of Representative member and 2 state senators that are 2 per state. So in the Senate, the terms are different. They run in 6-year overlapping terms, and there are only 100 senators, and they are 2 per state. And some states have Senate elections, and some don't. And it depends on when the voting term is. So that's the 2 bodies. Now, on the House of Representatives side, this is where the revenue legislation originates. On the Senate side, and this is a very pertinent thing today, one of the main items that the Senate takes up is presidential nominations and approving of treaties. So we have a Supreme Court justice that's been nominated by the president. There have been a number of Supreme Court justice hearings, and it is expected today that we will have a new Supreme Court justice when the Senate confirms. And it is anticipated that Judge Ketanji Jackson does make it successfully onto the highest court in the land. So stay tuned for that if it hasn't already passed. At least I haven't checked the news in the last hour and a half, but I know that they were scheduling a vote. But the main thing is now my last, the point second from the bottom is the two chambers are fundamentally equal in their legislative roles and functions. So an enactment of law always requires both of these chambers to separately agree to the same bill in the same form before presenting it to the president. So what could happen is that now, and I'm going to use an example of something that just happened, the price of insulin. There has been a lot of debate on how expensive and how the price of insulin has spiked in the last number of years. So just last week in the House of Representatives, they passed a legislation by simple majority that would cap the price of insulin. Now this bill goes to the Senate, where the Senate has to vote on the same bill in order for it to go to the president to sign into law. Now here's the challenge with that. The Senate can say, we don't like the version that passed the House, and we're going to amend the bill. And that is their prerogative to do. So if they amend the bill and it passes the Senate, it has to go back in the amended form to the House of Representatives and pass again in order for it to get to the president's desk. It's a process that doesn't happen quickly, that can always get derailed at the last minute. And this is how our government functions, or some could say doesn't function. Because in my future slides, I kind of show you the percentage of bills that actually get signed into law. But this is not the only way that legislation passes in the federal government. The president has influence in the legislative process as well. And that comes in the form of the president's annual budget. And this is where the president suggests legislation. The president cannot introduce legislation. That is the legislator's job to do. But usually, when the president announces their budget, Congress will work on making it into a bill that could be passed or not. So that's really important to understand. And perhaps more significantly, the power to veto legislation can affect the content of bills passed by Congress. It is quite unusual for law to be enacted over a presidential veto. Congress typically must accommodate the president's position on proposed policies. And this last bullet point is one of my favorite because it says everything I just said to you doesn't always happen the way it's supposed to. The process by which a bill becomes a law is rarely predictable and can vary significantly from bill to bill. In fact, for many bills, the process will not follow the sequence of congressional stages that are often understood to make up the legislative process. So it is not easy for myself, for anyone, to sit down at your computer and try to make sense searching to see what the status of a budget bill is or of legislation. That's where we need to rely on our organizations to help push the issue as well as interpret it. So I just mentioned the budget, and the good news is that our president just announced last week an increased support for nursing education and research. And this press release comes from the American Association of Colleges of Nursing. And the key points in this is that $294.972 million has been proposed for Title VIII nursing workforce development programs. This is a $30.5 million increase over last fiscal year, and it's a $14.5 million increase over the recently passed fiscal year 2022 bill. It includes $25 million in advanced nursing education to support maternal health, an additional 3.5 million for nursing workforce diversity, and an increase of $2 million for the nurse education, practice, quality, and retention program to help prepare nurses in rural and underserved areas. NINR, the National Institute of Nursing Research, has a proposed budget of $198.670 million in the next fiscal year to support nurse scientists and researchers as they help address racial, ethnic, and socioeconomic health disparities. This is huge for our profession of nursing. It's a large sum of money, and this has not passed yet. This has only been proposed. So in the coming weeks, we look for this legislation to be enacted and actually passed so that these priorities can actually be funded. And when the time comes for us nurse researchers to apply for federal grant funding, the money will be there. Or when there is HRSA funding for workforce training grants, the money will be there once it's appropriated and once it's passed accordingly. This is, again, I tried to give you as much recent information as possible because policy does change. And what was policy a month ago may have changed, or even a day or so ago may have changed. So this is important. All right, so who makes up the 117th Congress? Well, again, you know, we have a bicameral Congress, and there's a House of Representatives, and there's the Senate. There is a Democratic majority, in a thin one, in the House. There are 221 Democrat members. There are 209 Republican members. There are currently 5 vacancies, and sometimes people step down and take other positions, and that's why there's vacancies. There are some representatives that die in office, leaving a vacancy, and it's up to that state to determine when there's going to be a special election to fill the remainder of that seat. But remember, this is an election year, and even if there's a special election tomorrow of those 5 vacancies, that seat will have to be once again run for in November. So 435 districts, 435 members in the House with a slight Democratic majority. In the Senate, it's even thinner majority. There are 48 Democratic senators, there are 50 Republicans, and there are 2 independent senators that align more so with the Democrats. So it is considered a 50-50 split Senate, and the Vice President of the United States is the President of the Senate. And therefore, that person, in this case, Vice President Kamala Harris, is the tie-breaking vote in Congress. So that's why it's really important. And you can tell in Congress today, it's very difficult to get any legislation passed. The difference in the House and the Senate is that the House will approve bills by simple majority, whereas the Senate needs 2/3 majority to pass. The only asterisk to that is for budget and for court nominees or presidential appointments, where they only need the simple majority. So in today's Congress, in the Senate especially, it being so tight, it's very, very difficult to get legislation moving. I used this slide just to show you who the leaders are of the respective chambers. Speaker Nancy Pelosi is the Speaker of the House because the Democrats have the majority and she's out of California. Coincidentally, the minority leader is also out of California, Kevin McCarthy. And these are positions that the the members of Congress actually run for, and it's debated amongst themselves. So Nancy Pelosi has won the speakership amongst her peers in the House. And same thing in the Senate. We have Majority Leader Chuck Schumer is a Democrat majority leader out of New York, and the minority leader is Mitch McConnell, Republican out of Kentucky. And just, very recently, Mitch McConnell was the majority leader. But since it flipped with elections back in 2020, we now have a Democrat majority. But don't think that one party being in control of the president, the House, and the Senate means that things automatically pass, because they don't. And that's where we are in Washington today. So how does one find legislation? Well, you go to congress.gov, and on this website, you could use search terms, and you could put in any search term that your heart desires. You could search nurse practitioner or nurse or climate health, and anything relating to that will come up in the search engine, and you could tell who the sponsors are, who the co-sponsors are, and you can actually read the language of the actual bill. I will admit it's not easy reading. You read it, and you need to read it. I need to read it multiple times and really figure out what this is doing. And I think intentionally, sometimes that's meant to be, but it shouldn't be. It should be transparent. But this is what why we need to be aware of what is being passed, because it will affect everyone living in that either in that state or in that country. All right. To give you an example of bills passing both chambers, you could see in this 117th Congress, which started last January, there have been 13,209 bills that have been introduced in total. There have only been 107 of those that were enacted into law, which means passed both chambers and was signed into law by the president. That is a 0.8% percentage. That is not a lot of bills making its way into law of the land. And if you look back at the last 10 years or so, you can see in the best scenario, we've only had 3% of bills that were introduced, passed both chambers, and being enacted into law. So it really is difficult to pass legislation. Certainly, bills that need to pass are things like the budget and resolutions that keep the government from running, that offices are open, and appropriations and things like that. But just because there's a good bill out there and everybody agrees on it does not mean it automatically is going to make its way into law, because there's somebody or some organization that wants the opposite position of that bill. And it comes down to sort of lobbying dollars and how motivated and how much of a political outcry do people want this issue, right? And that's what helps to move the needle on legislation. There's also regulation. And think of regulation as the policy and procedure manual to what was written in legislation. So legislation tends to be more broad, and regulation is much more specific. So let's think about, again, Nurse Practice Act is legislation, but what the Board of Nursing comes up with, their rules are regulation. So the important thing to know here is that at the end of the day, regulation has the same effect as legislation does. So for example, as an RN, if you're not following a regulation, well, you could be found guilty of not following that regulation. And there could be fines and suspensions as a result of that happening. Again, the Nurse Practice Act is the law. The Board of Nursing writes the regulation. And every regulation, believe it or not, has to be published by the agency writing it. So again, in this case, I'm using a state level example, the Board of Nursing. It has to be published in either what's called the state register, which is at the state level, or the federal register, which is at the federal level. And it's open for public comment. So you can go right now on your state register's website and see what's been proposed by the regulatory bodies in that state. And you as a citizen, as a person living in that state, you can weigh in on that regulation. You could say, I don't like this regulation. And you write in, and the regulatory body has to read it. And if they get overwhelming negative feedback on something that's been proposed, well, they will go back and rewrite it and say, there's been a lot of opposition on this regulation. We're going to rewrite it and republish it and put it out again for public comment. And that's how regulations take place. And at the federal level, you can go to regulations.gov. And on this website, again, you could search general search terms, but it tells you on the right-hand side, it has this dashboard of what comments are due soon, what's expiring in the next 3 days, because there's always a window of when a comment is posted and when the posting period closes. But you could go on that website right now, search, and you could comment on any regulation. And I encourage you to do so because it's important, again, to understand what's been proposed. Whoop, all right, but laws and regulations are not the only thing that we are needing to follow. As nurses, many of us work in institutions, in hospitals, in academic centers. And because of that, they have their own sets of rules. And any of those rules could be more strict than what the law is in the state. And I use the example of nurse practitioners. In some states where a nurse practitioner doesn't need to have a written collaborative agreement, the hospital can say, that's fine, that's what the state law requires, but if you want to work in our facility, you need to have it. And you really have no recourse other than saying, I'm not going to work there if that's their position. Now, what I've always tried to encourage people is to get on committees in your institution. And if you see something that's not kept up with the law or with the changes, ask questions and try and get it changed so it matches. And that's easier said than done, but it's something that I encourage people to get involved with. Insurance companies, same thing. The insurance company can do anything above and beyond what the state law allows. So keep that, and that comes to mind if you're being credentialed or if you're being impaneled by an insurance company. And the other thing that has an impact is the public's perception of nurses, right? There is a knowledge deficit of what nurses are and what we do. It's better, it's gotten better, and it continues to get better. But there are still people out there, and some of those people may be our elected officials that don't truly understand the role of the nurse. They don't understand the role of the nurse scientist, the nurse practitioner, the nurse researcher, et cetera, and so on. So I believe it's our job to educate them, to educate our patients with every encounter. I am a nurse and I do this. We know this, that for 19 years in a row, when that Gallup poll comes out, nurses have been the most trusted profession 19 or 20 years in a row. That's amazing. We have the public's trust. But in my opinion, I don't believe we utilize that to its capacity, because it takes a lot of effort for nursing issues to pass and to be made into law. And one of the big issues that come up is nurse-patient ratios, right? This is the talk that's going on in many states, in many hospitals. Nurses are burnt, right? And they're partly burnt because they have unrealistic patient ratios to what they're working in that shift. Well, it would seem that the most trusted profession would have no problem going to their legislators and saying, hey, you need to limit the amount of patients I have in one shift. But who's going to be on the other side of that? And the people on the other side of that are going to be hospitals. Hospitals are going to say, we can't afford more nurses. So you get the hospitals involved in saying, no, we don't want to mandate this law. We'll work it out and, do it our way in the institution. But they don't have to follow a law that doesn't exist. So that's why, again, it's really important to get involved and to understand what it is all about. So in my last few slides, I'm going to talk about a political action committee. And a political action committee is also known as a PAC. And it is a popular term for a committee organized for the purpose of raising and spending money to elect and defeat candidates. Most PACs represent business, labor, or ideological interests. PACs can give $5,000 to a candidate committee per election, which includes a primary, general, or special committee. And this definition is through opensecrets.org, and I'm going to do a little exercise on that. But before I do that, I want to ask another poll question, and this is poll question number 5. The question is, have you ever donated, and this is all anonymous, so we don't know who's voting, have you ever donated to a candidate for public office? Yes or no? And I'm just going to wait about 15 seconds here. All right, last call. Have you donated to a candidate for public office? Yes or no? All right, let's close that poll. Majority who responded said no. 63% have said no, and 38% said yes. Thank you for taking that poll. To show you the power of PACs, political action committees, I have an example here. This is the American Nurse Association's Political Action Committee, and this was the last 2-year cycle that I was able to gather data on. And in the 2019 to 2020 time period, their PAC, which is a separate entity from the ANA itself, PACs have to be separate. They have to have their own board of directors, their own treasurers. They have to be incorporated differently than a nonprofit organization. But the ANA raised $513,000 in this 2019-2020 time period, right? So $513,000, $500,000, not bad, right? They spent 397 of that money that went to candidates. Let's look at the American Medical Association, the AMA, and how much they raised in their last political, in this cycle. They raised $1.6 million, and they donated $1.7 million of that money to political candidates. There are way more nurses in the United States than there are physicians. It is estimated that there are over 4 million nurses. And I hate to bring up the money aspect in politics, but money is a part of politics, and that's where these PACs come in. So this is corny, but imagine every nurse donated $1 in the United States to the PAC. That would be a $4 million PAC. That would blow away the amount of money that ANA has currently raised. And there are different PACs and there are different committees. And I am not saying that the ANA is against the AMA. There are certain issues that overlap, but I will tell you this, the American Medical Association is not lobbying for nursing issues. They're lobbying for medical issues that benefits that profession. They're not benefiting the nursing profession. So I will also say this. I know that not everybody agrees with organizations and nonprofit organizations. And this is not the only nursing organization that exists, but it's just an example that we should be participatory in our organizations, as well as who we want them to donate money to. We want candidates who support our profession, and we want to defeat candidates who oppose our profession, who don't see the value in nursing. So that's just one of those examples. So grassroots, how do you get involved? Well, you schedule a visit with your legislator. It's easy to do. You go on their website and you ask to meet with them. And in today's world, that could be virtual. It's very easy to set up a Zoom appointment with your legislator. You can also set up a meeting with their legislative aide. And oftentimes, speaking to the legislative aide is almost more important than speaking to the legislator themselves, because the legislative aide or the legislative director is going to know the issue in much more detail than the legislator. So you want their staff to understand. You could write a letter to your legislator. You could write a letter to the editor of your local news publication, putting your issue out there, and you can participate in Lobby Day, which brings me up to question number 3. I went out of order a little bit. Poll question 3, have you ever attended a Lobby Day at either the state capitol or in Washington, D.C.? Yes or no question, and if you've done both, you can answer yes to that. All right, let's close that poll. Let's see. So majority have said no, 71% have not gone to a Lobby Day. And certain organizations hold Lobby Day, right? It could be a nursing organization. It could be a specialty organization, but the majority of folks have not. All right, we're in the home stretch here. So again, be involved, donate money to the Political Action Committee, join state and national nursing organizations. I'm not saying just join anyone, but join the ones that are important to you and you feel that are doing the good work that's necessary. And social media plays a role in all of this. You can be out on social media by promoting the issues that are important to you. But there's good and bad with social media. The bad is there are trolls. There are people who are trying to engage with you and in ways that are not for the, they do it because they have an agenda that may be opposite yours, and it can get nasty. So don't engage with the nastiness, block those people, mute them, and just don't drop to their level. So I know there's only 6 minutes left here. I do have this website that I'm going to drop in the chat. And in your free time, I would love for you to go to this website. And there are 2 bills that you could write to your legislator, your federal legislator, and ask them to support. One is the future advancement of academic nursing, and there's the Senate and HR bill numbers. And then there's the United States Cadet Nurse Corps Service Recognition Act. Very easy to go to that website, very easy to just drop in your name and your address. And don't forget, well, not don't forget, but always try and make the letter to your legislator personal. And I will say this, your letter will be read by somebody, but if you just copied and pasted a letter that looks exactly like all the other ones that people are sending, it's very much likely to get a canned response. Try and make it personal. Try and say, I am a registered nurse working on this topic, and I live in your district, and this is the issue I'm writing to you about. So keep that in mind as you go forward. And I know that there are some questions in the Q&A that I'm going to. Nursing schools need to have a one-day lecture in this. Yes, in fact, I would say it could be a whole semester's worth of content. Question about needing 2/3 vote to pass bills in the Senate. Catherine asked that question. If you could clarify that regarding the 2/3 vote. The slides, we'll make the slides available in an email after this. So we'll email everybody the slides. I have no problem sharing these slides. Let's see. How do we pass NP full practice autonomy in Texas? So many attempts have failed, unfortunately. Yes, this is, some states are harder than others to pass legislation. Texas is one of those more difficult ones. It needs to be a coordinated front. It needs to be a united front, and you need to overcome, and you need to vote for candidates who are nurse practitioner friendly. And you need to ask them that right up. Do you support nurse practitioner practice? And if they say, no, I don't believe in nurse practitioners, I only think physicians should be caring for patients, well, I would not vote for that person. So that's that. I know there's another slide here in normal order. Well, let me just read this slide and see if I could answer that. Yes, so it is true. And this question or comment on in this chat goes into more of the detail about the Senate rules. And I gave a very rough overview, but there are, definitely supermajority rules and a vote threshold that needs to be maintained. And that is correct. I misspoke when I said 2/3 majority in the Senate. It's a 60 vote supermajority. It's a 2/3 for veto overriding. So I apologize, I misspoke on that. But generally speaking, the Senate, in order to pass a bill in the Senate, it has to be a 60 vote supermajority. So thank you for clarifying that. All right, well, you can certainly get in touch with me. I'm going to put up my contact information, and this is my last slide. Has my email address on it. Feel free to email me. I encourage you to be on, of all the platforms of social media, Twitter is my least favorite, but it is where the legislators do a lot of their where they are. So definitely try and be on Twitter if you're trying to advocate and be an activist for issues. So keep that in mind. Thank you so much. I know we're at 2:59. I'm gonna, Catherine Dodd says, follow @nurses_America. This is a great grassroots organization that's working on issues that are specific for nurses. Also in the chat, you'll see the link for the continuing education survey that you need to complete in order to get your one contact hour. And that's 1 hour, that's 3 o'clock. Thank you so much. We will continue this conversation at our Scholar Conference in October. And maybe we'll even have to do another one of these from now until then. So with that, thank you so much. Thanks for joining us today, and till next time. Run for office.